for joining us on this timely and relevant topic. I've got just a few slides here to get us started. Of course, we have our annual conference coming up just next week for AAMG. The data is a little outdated already. We have over 500 attendees registered for the conference this year. That's up significantly over what we typically get on site, which is around 350 to 400. So we're hoping to have at least 550 of us at the conference this year. It's still not too late to register, of course, so I've got some of that information on the screen here. If you're an AAMG member, you're eligible for one of our CREST grants that you can apply for, which reduces the cost of the conference to $0 for you to attend. If you're a non-member, you can still apply to our hardship fund if that applies to you for a variety of reasons, and that reduces the registration from $150 down to $15. So again, we've really tried to make a point this year to get as many of us connected through AAMG and the conference as we can. A little bit about today's session that we're offering. So we'll do introductions in just a minute here, and then we'll allow all of our panelists, roughly 7 to 10 minutes to talk a little bit about where they are in the reopening process, some of the challenges that they're facing, how they've developed their plans, some of the unique challenges that they're facing. And of course, we want this to be a dialogue as well. So again, keep those questions coming in. Alexandra will help monitor some of that during the conversation. And then when all of the panelists are finished, then we'll also have some more time for Q&A. And so with that, I've already introduced myself. I also serve as the treasurer for AAMG and am co-programming the conference this year along with Katie Lee Coven on this panel today, and Natalie Marsh, who's at Kenyon College. Katie is at Utah State University and serves as the executive director and chief curator there, also our vice president for state and regional representatives. Tricia Miller is the head registrar at Georgia Museum of Art, and so she's joining us today representing the southern region. And then we have Dr. Leslie Wright, who's with us from Grinnell College out in Iowa, and so she's the director there. And you recently had a name change, I think, for the museum. Did you not, Leslie, like within the last couple of years, maybe? Oh, she's muted.
Yes, yeah, I'm here. A year ago, we moved from being the Faulkner Gallery to the Grinnell College Museum of Art, and that change has gone extremely well.
That's right. I still accidentally refer to you under your old name from time to time. So it takes a little bit of...
I've only just gotten used to it myself.
That's right. That's right. And so with that, I'm going to go ahead and turn this over to Katie first, if that's okay. Katie can present for a few minutes, of course, on her reopening strategies. We'll let Tricia go, Leslie, and I'll wrap things up at the end, and then we can take Q&A, if that sounds all right.
Sounds great. Thanks, Craig.
Yep.
Hi, everyone. I hope what we share today can be useful, and I hope that we all learn from each other today because, of course, this is a new territory for all of us. So I'm at Utah State University, and just to give you a sense of where we're located, we're about an hour and a half north of Salt Lake City. In the county that I'm in, we have about 120,000 people. And until about 2.5 weeks ago, we only had about 65 cases of COVID-19 here in our valley. But in the past 2 weeks, with a meatpacking factory has had a lot of testing, and we now have over 700 cases in our county. And we have been number 1 or number 2 for hotspots for increase because we've seen a significant increase in the entire country. So it's really interesting because percentage-wise, we're still pretty low, but when I started our reopening plan, the situation that we were in was quite different, even a week and a half ago, 2 weeks. And I think we're all going to be dealing with that moving forward. So, but there were some things that we considered as a staff that I think can help us manage this pretty well. If the cases, if we want to get more restrictive or more lenient as time goes by. So I'm going to just go through. I'm going to share my screen, Craig. Let's see. Give me one sec. All right, I thought it might be effective to kind of share with you what we have done thus far. So we just reopened our museum. We reopened it to members only last week and reopened to the public tomorrow. And we submitted a reopening plan to the COVID task force here at the Utah State University campus. And I reached out to them early on to seek their input on and guidance and developing a plan. And so I've tried to just break it down quickly here, some things that we sent to them initially. A justification for reopening prior to visiting, what we're asking visitors to do, including an online reservation form, which I'll show you how that works. Sharing their contact information in case we need to contact them, checking a couple of boxes about what we're asking them to do when they visit. And then we've also outlined the things that we will do and are doing in terms of our cleaning plan, sharing that with the public, and guidelines that we've created. We have plexiglass that are at our front door, at our front desk, and a lot of signage, which I'm going to share some of that with you briefly as well. And then we're asking visitors to wash their hands or use sanitizer when they enter, collect any materials we're providing them, to not return those to us, like gallery guides and things of that nature. We'll have pencils that they can take with them. These are some of the signs that we've developed. So when you enter the museum, we have right now, the way we've structured it is an optional online reservation to ensure that you can have access when you come. We have the beauty of it is that we were initially going to require online reservations. And then as our state moved from orange to yellow, we went to an optional online reservation to ensure that you can get in when you would like, because right now only half of our museum is open. So we're limiting visitors to 30 people at any given time, which allows about 100 square feet per visitor. Allowing plenty of space when people come. So right now it's an optional online reservation to ensure that you can get in. If you can't, then we'll offer them a sculpture walk map, which are outside, as an alternative that they can do while they wait for the museum to clear out. So this is the sign when you come into the museum. In front of our front desk, we have a table with the materials that are placed along with hand sanitizer and these reminders to our visitors. And a lot of these we see, again and again on signage. We also place signage by our elevator to ask people to take the stairs if possible, to take the elevator only with members of their group. And then we also have placed a sign that we reserve the right to ask visitors to leave if they're not respecting our safety protocols, or if they've reached the limit of people being able to be in the space at any time. We reached out to our university police to let them know, make sure they knew that we were reopening, that what should we do if something were, a situation were escalated where someone, would not comply with what we're asking them to do. And of course, if someone needs to be escorted out, they want us to call us, but they're hoping that we can handle the conversations with people, and that doesn't happen, of course. So we've done a lot of training with our visitor services staff about the dialogue and scripts that they should be using and engaging with our visitors. Here's some floor signage for our lobby where we've taken a piece of artwork that's 6 feet long. It'll be vinyl on the floor and to remind people of distance. And then we're placing these around our galleries, just as a reminder, as vinyl stickers that will be on the floor. We have a museum store. It's small, and so what we're doing is keeping a stanchion there and asking them to allow our attendants to help them if they to handle any of the merchandise. Just to show you briefly the optional online reservation system. So we reached out to our event services here to help us with that, and they already have a system in place. So on our website, there's a on the main page and on the About Visit page, you can find the reservation form. These are just screenshots to show you what it looks like. So we're collecting. You do have to create a sign-in, provide a phone number. You select when you want to come in. And the time you want to come in. And then we're asking people to self-identify, and then our protocols and policies, that they're agreeing to those terms. And then at the end, it tells you, it confirms it, and it actually sends you an email and you can add it to your calendar. So again, the nice thing about this reservation system is we can go to requiring reservations, we can increase capacity, we can decrease capacity. And so there's some flexibility that's nice, that's built into having this system. Other considerations that that I wanted to bring up. So we're going to be offering masks free of charge, working with our university printing facility. So they're actually providing 2 masks to each USU employee for free. But I've asked them to add our NEMA logo for a small fee, and then I've ordered 200 of them to have on hand, which they should be here today or tomorrow, actually, so that if someone comes in and they don't have a mask, I feel fortunate that we can offer them for free, and they're priced really modestly by working with the university printing area because they're already ordering a lot of them for the university. I know some places are charging for the mask, but I feel like if we want to really encourage people and to support the safety of our staff, that being able to offer them for free is a really nice thing that we can do. And of course, having the branding of our museum and university on there is, something that's nice to offer as well. I mentioned that we contacted the university police. I didn't show here, but there's a new page on the AAMG website where we will be, and I hope you all as well, share documents for your reopening. And so I can place our cleaning schedules or share those as well. But we created new cleaning schedules for our visitor services staff. We shared those with our custodial staff to ensure that we were not duplicating efforts and schedules. And then we also discussed as a staff, when we are open, what our practices will be, both in the office and around the museum. So we're all on the same page. So we agreed when we get up from our desk and move around the museum that we will be wearing a mask, and that will be our standard practice. So those are just some of the other things that we have worked on. I also had to purchase, lots of hand sanitizer, which we have on hand, and of course, there's other signage where we have our study center drawers and things about how to handle those scenarios. So that's where we are here at our museum, and let me stop sharing. And that's all I have.
Great. Thank you for sharing, Katie. And did you want to take questions now? Because there were a few that came in over the chat, or would you rather wait until everyone's presented? Do you have a preference?
I can go ahead and take a few now.
Sure.
And
I
if
think
they-
I think Alex is recording some of those.
Yep, I've got a few here. How many visitors per day are you getting right now?
So we reopened to the public tomorrow. Reopened to members last Thursday, Friday, Saturday. And we did that really as a way to just test. Well, one, right now it's challenging to offer member benefits, and we're all getting creative with that. So we wanted to do that. We're also going to actually, similar to senior hours at grocery stores, offer member hours regularly as well. So we haven't, I don't know the numbers yet because we'll reopen to the public tomorrow.
Great. One of the other big questions that came up was, in addition to sharing these plans on our AAMG website, which we already started building out that page, would you also be willing to share the scripts or examples of the training that you've done for your staff? And I think that's a question for everybody on this call. Yes. Okay, great. I'm getting.
Yeah, and we, I looked at AAM and many other, examples of suggestions that they were providing, and the Chamber of Commerce, different guidelines to build hours. And our visitor services staff were the ones who really created it and did the trainings, but we all worked on it together. But I'd be happy to share those as well. Absolutely.
Great. I think the other big one right now that's really specific to you is just the program that you're using for the reservation system. Mm-hmm. What is that program? Is that generally accessible, or is that built just through your institution?
It's a USU system that they happen to have already in place. If you have, the reason I knew the university had a system is because we have a conference center, and the University Inn, they have reservation systems that they use. But I didn't realize actually when we reached out to them that the event services here actually has a system that works, as I showed you, that is already in place. So you might reach out, it's possible you have an entity on your campus that has a need for a reservation system that you could see if they would share with you. And that's essentially what they did. And it cost us nothing for them to do that for us.
That's great. Okay, there are many other questions, but I want to be cognizant of time and getting to our other panelists. Who is next? And we will continue trying to answer your questions as much as possible in the chat and the Q&A, but please feel free to ask them again as we go through this, of course.
And Katie, there may be questions that while Tricia is presenting, that maybe if you take a look at the chat, you might be able to address some of those just so we can be mindful of time. But yeah. Tricia, if you wanted to maybe present a little bit about what your institution's doing.
Sure, thank you for having me. So I'm the head registrar at the Georgia Museum of Art at the University of Georgia in Athens. We are the official state art museum. We're housed on the campus of the University of Georgia, and we are administered through the university system and the Board of Regents system. So the University of Georgia is a large state university. It serves about 38,000 students. So we are a little behind, Katie, on our preparations at the moment. So the University of Georgia just released last Friday their guidelines for the entire university for reopening. And the first phase of that reopening starts on Monday of next week. So just to briefly summarize what their 3 phases for reopening are. So the phase 1 that starts next week is supervisors designated by deans, directors, and department heads are to return to campus to evaluate work environments and ensure that they're configured to reduce health risks. And any mission critical personnel and their teams are to be reporting. And now these staff members are allowed to stagger schedules and do some form of telework and on-site work in order to meet current distancing guidelines if that's needed. And that's working towards phase 2, which is supposed to be sometime in early July, where all supervisors return, and again, mission critical personnel and their support teams are there And this is meant to be a training period for staff and personnel in preparation for phase 3, which is the commencement of the fall semester. Classes start on August 20th, so that is essentially our target date that we're working towards. So with that target date, again, as far as staff are concerned, there is an option still to work with partial teleworking and staggered schedules if your particular office situation needs to do that to meet distancing guidelines. So we're now working toward, as a team at GMOA, we're working towards setting up our own protocols and deadlines and guidelines for working within the ones that have been presented to us by UGA. Now, we had set up a couple of protocols and guidelines ahead of these simply because we knew we were going to be having some work and some interactions taking place. So actually myself and our chief preparator had put together a couple of guidelines related to receiving, releasing, and handling works of art and doing cleaning around works of art. And I've sent those protocols to Natalie, and I think they'll be available through AAMG after this webinar. So we did put a few things together ahead of time. We had traveling exhibitions on the road. We had some other art sort of traveling around domestically. Thankfully, we didn't have anything overseas at the time things started to shut down. So we knew some of our staff was going to be interacting, particularly with fine art shippers. And so far, those interactions have gone very well, and we were happy to have some protocols in place. So not only that our collection staff were prepared and understood the expectations, but also we communicated with the shipping companies and were able to come to an understanding of what the expectations would be for everyone who would be in our building for those particular interactions. But now we're working towards developing protocols for the entire museum operations. And so our director, Bill Island, and our deputy director, Annalise Mundy, put together a steering committee. And that committee has recommended 8 subcommittees manned by our staff to come up with protocols for each part of the operations that we oversee. I won't go through all of them. I can type them into the chat later. But those subcommittees were tasked with developing their own protocols. Those have all been submitted to the director and deputy director. We're actually meeting on Thursday, the steering committee, to go through all of those protocols. And while each sort of department or area of operations is going to have particular procedures that they'll be following, we also want to make sure there's a consistency of expectations across all of the departments. And a consistent message that we're going to be sending out to our visitors and to our community. I just thought to mention a couple of things that I sort of feel like I've learned as we worked through this process a couple of times. First, in thinking about these guidelines and protocols, I often found that it was pretty easy to get bogged down in a lot of minutia about every single scenario you could think of, about what might be happening. And I had to keep reminding myself to step back and try to strike a balance between the details that we need to pay attention to and leaving yourself enough room for change and for adjustments. This is an evolving situation. It's going to continue to evolve, and you need to leave yourself that room. We consider all of our documents living documents. They can be assessed and changed at any time. So I think that was something that I had to keep reminding myself, was you don't have to figure out every single detail right now. Another thing was think about your contingency plans too. I don't think we should be thinking about reopening plans and guidelines as a step away from what we are doing now. A lot of us have shifted to a lot of really great remote engagement with our audiences, and we need to find a way to continue a way to do that and reopen to the public. We don't know if in the fall or winter you may have a resurgence in your area and you may be asked to shut down again, and you're going to need to be able to shift back to some of those remote engagement programs that you have developed. So you know, as a lot of people keep saying, it may be a cliche now, but it's going to be a new normal when we go back. So make sure you have a contingency plan if you do need to shift back to a more remote situation. Also, get the buy-in from all of your staff. We're a staff of about 30 here. And part of our, you know, subcommittees was making sure that we were engaging all of the staff. The staff are going to have different levels of anxiety about returning. Some people are anxious to do it right now and would come back tomorrow. And some people are still pretty fearful about coming back and working in an office, particularly people who work in cubicle situations. So be transparent about your process with both your staff and your visitors in your community, and engage everyone in that process, and make sure you have opportunities for feedback, not only while you're developing them, but also once you put them into practice. Because as we all know, real world situations are going to be different from what you thought through in your head. So make sure you're getting some feedback, and again, leave yourself that room for change. And also, as you know, we're all at universities, so work with your administration and your legal departments on what you can and can't do. I know, for instance, the University of Georgia is strongly recommending the use of face masks, but not requiring. The university is actually purchasing and distributing 2 cloth face masks to every faculty member, staff member, and student on campus, but only strongly recommending those. And I know my director would very much like to require, particularly our frontline staff who are engaging with the public very often, he would like to require them to be wearing a mask. But we have to figure out what kind of leeway we have with our administration and with our legal department to make requirements as opposed to recommendations. And then finally, I would just say, you know, make sure you know what your visitors are comfortable with. Our communications department sent out a survey to our friends and members and anyone who's on our general emailing list to get an idea of what, you know, types of things people would be comfortable with, and how willing they would be to come back and visit us. And thankfully, the majority of people would say they would be very willing to come make a visit to the museum. And I found it interesting that in a question about what types of procedures, you know, masks or signs and things that we might be able to do, that the most popular sort of strategy was limiting the number of people in the building. Now, we are free and open to the public, so we don't have a current ticketing system. So like Katie, we're going to need to develop something that would be sort of a time ticketing system. And I feel like also, like Katie, I don't think we would be particularly restrictive about that. If somebody comes, we want them to come to the museum. But we're looking into ways to do that. I also had that question, Katie, about how did you get that system online? So, so those are just a few things I feel like I've learned, and I'll just end with a quote from our educator, who in one of our meetings said that she found that closing down turned out to be relatively easy. It's the reopening that's the hard part. So, thank you.
Thank you, Tricia. Alexandra, did you have any specific questions for Tricia at this time?
Not specific ones for Tricia, but a few things to keep in mind for Leslie and Craig as you guys talk about your institutions. In particular, what is the number of staff that your institutions are each working with? Do you know if you will have online or in-person classes this fall yet? And are you operating under regular or reduced hours? Those were a few of the generalized questions for all of you to be thinking about. So if you could incorporate those moving forward, that might be helpful to answer a couple of questions. And with that, I'll turn it over to Leslie, I believe. We'll have you speak next.
Great. So I am going to, I guess, hold down the small college end of the academic world here. At Grinnell, we are still waiting on guidelines from the college. We thought we were getting them yesterday. I haven't seen anything yet. That said, I've been sitting on a couple of different committees that are working on pieces of all of this. which is hard because there are other committees working on other pieces that you dearly wish you knew what they were doing, so you could put it all together. Iowa is a state that rapidly reopened. We are now, as far as I can tell, just about fully reopened. We're still seeing somewhere between 200 and 400 new cases a day across the state. Our particular county is pretty quiet. We only have had 92 cases so far, and most of those have recovered. However, we have a national and international student body, and there's a lot of concern about those people coming back together. So what we do know is that fall will be probably 500 out of our 1,650 students here on campus. Priority will go to first-year students to get them acculturated and into the system. There will be many, many restrictions on how they live and go about their daily lives, from who they room with to who they eat with, and what we're not sure on yet, what we're waiting to hear is if they will be able to move freely around campus and do things like wander into a museum, or whether that has to all be done by appointments at any level. I guess we're moving our teaching schedule from a full semester to 2 7.5-week terms, they're calling them. Each will have 2 courses. We don't yet know who's teaching in which half of the semester. So that means that most of the people teaching will be teaching online in the fall. Not all, and some classes may actually have a hybrid of some students on campus and some off campus. All of which makes it a lot more complicated for us to serve the faculty, because we don't know if we're serving them virtually or if we're serving them in person in the museum. At this point, we think we are going to reopen on September 4th with our fall show. We may reopen a little earlier if there are faculty who are teaching on campus and need to be in our space. We do have a print room that's usually in our library, but it's a very small space and really is difficult to do any social distancing in. So we think we will move and recreate the print room in our large museum space, which is a single open room of about 7,400 square feet that we can partition. So we will cordon off a part of it as a study room space where classes can meet, we think. Our front door for the museum is inside an academic building. And this has been one of our biggest hurdles so far, is how will people come to find us? I'm pretty sure, though we have not been told definitively, that the public will not be allowed to come visit us in the fall. So we are serving only the campus. We are currently working with a lot of people in our community for summer programs, trying to do as much as we can virtually. So we are getting some practice on that. But as we all know, creating virtual programs is very staff intensive. And my outreach curator is definitely being stressed a lot in trying to generate all this content. And there's a number of our constituents who just don't use technology or can't use technology or don't have access to technology. So it's difficult for us in that way. Let's see. Over the course of the year, they're saying they're going to try to give every Grinnell student some time on campus. I think the hope is they can open up more and more as the year goes on, but we all have to wait and see what happens with that. There will also be a limited number of faculty and staff on campus at any one time. So how we serve them is going to be another question mark for us. So we have not resolved things like how many visitors, because we don't even know how people will be allowed to visit us. Will they be allowed to just stop by, or will they only come in classes, and that would be probably in a by appointment situation. There is no ticketing or reservation system that we use on campus, so we would have to create that entirely new. It's not something that we do at Grinnell. I mean, we're lucky to be in a small town in rural Iowa and have been able to always be very open with everything we do and offer everything for free. it's now kind of coming around to bite us because we don't have systems in place to take care of these things. Let's see, what else was I going to mention? So
Leslie,
Yep.
Sorry, I have a clarifying question from somebody actually. Did you
Okay.
say that only 500 students out of your full enrollment will be back in the fall?
Yes,
Okay.
I
Okay.
did. Yeah, so and I have heard, though I haven't seen this confirmed, that in the second term, the 7-week term, 250 more students will be added, but that also a lot will depend on what we are seeing in terms of a resurgence of the virus or a flu season as we head into later in the fall. We are being asked on campus, what I'm hearing is we will be not wearing masks, we will all be wearing face shields, students, faculty, staff, which the college will provide. And I am hoping they will also make sure everybody knows how to keep them disinfected, because that's another piece of it. I'm hoping this gives us some room to be a little creative, because the face shields I've seen on sale in town say very prominently across here, face shield. So I'm hoping we can rebrand those perhaps, or add some bling, or do something a little more creative with face shields if we're all going to be wearing them all the time. And this, I think, is for two reasons. One, there's a public health doctor at the University of Iowa who's done work that has determined that face shields are just as safe, if not safer, as face masks. And also for our students with any kind of disabilities where being able to see a face and a mouth is important, a face shield is much more accessible. I see a question. Yeah, the question was 500 of, our total enrollment is about 1,650. One big challenge we have is 20% of our students are international, and international students who are currently out of the country cannot get a visa right now because all US consulates are closed. So they simply cannot get back for the opening day of school in late August because they will not have their documentation in place. And for us, that's a big proportion of our student body. Some things that we have been holding staff meetings and talking through as much as we can. Our guards have asked that we definitely have plexi shields up in front of them at the desk. And our desk is inside the museum. There's no space for it outside because that's a public rotunda for anybody that walks through. So that would be a very odd space for them to occupy. And we're going to move the desk so it's closer to the front door and they have a better view of anybody coming in and out. And we can use the desk to actually split the stream of visitors who are coming in and going out to give some separation to those two groups. We're going to continue doing very robust digital and social media. We are going to be digitizing as much of our collection as we can, especially once we start hearing from faculty about works they need to be using for the fall. We will reopen in some capacity, whether we have many visitors or not. And somebody in the chat had asked if this museum might be used as a space for larger lecture classes where people could really spread out. We haven't had that request yet, but it has crossed my mind that we could be a space where you could do that potentially, depending on how we set up. We did shift from doing a lone show in the fall because we didn't know what kind of visitorship we could get, to doing a collection-based exhibition. So that's well underway. That was the first big change we made. So I think I'll stop there and see what other questions come up.
That was great. Thank you, Leslie. In the interest of time, let's go ahead and have Craig talk about the Denos, and then we can tackle a few of these questions that have been popping up, I think.
Sure. And if there's, you know, if we're able to stay on a few minutes past 3, because I know there are lots of good questions coming in, we'll do our best to try to answer as many as we can in the interest of time.
Yes.
So I'll go very quickly here. I'm at a community college museum up in Northwest Lower Michigan. We are sort of the gateway, like many campus museums, for our community. And so we're about 55,000 square feet. We have an auditorium connected to the museum that seats close to 370. And we program events for campus and our own concert series as well. So we've really, our entire spring concert series was canceled. We've had to rethink events and event income for summer and into next year. And of course, we have a pretty robust membership program too. So like a lot of us, our small staff of 6 has really had to think about what kind of benefits can we offer members during this time that they're gone for 3 months from the museum. How do we think about revenue and engage students as well, K-12 and college students. So we actually just received word last week that we would be allowed to reopen museums on the 8th in the state of Michigan. We decided, of course, working in partnership with the campus, to delay our public reopening until June 22nd. And so today is our first day really back in the office as staff at 50% capacity. We're going to be here taking turns for the next couple weeks, while we also work remotely, 60–70% of the week for the time being. Our big concerns, of course, are trying to think about how do we create a safe, experience for our visitors getting back in. And so some of the work we're doing, is in partnership with facilities. And so facilities is installing plexi guards, like I think many of us are receiving. We have a museum store, and of course we take payment at the front desk too for non-students, for our member population. So we can take contactless payment up at the front desk, but in our store, for example, it's not contactless. So we've been doing research and trying to transition the store system to a new Square-based terminal over the last couple weeks and months here. Our auditorium is an entirely different story, and some of you may be in a situation where you have either classrooms. We have a classroom and an auditorium that our college students use on campus. We've had to work closely with college administrators to figure out how to use those resources. Is the museum staff going to be responsible for staffing non-museum events? We also had to furlough 10 of our part-time supplemental staff about a month and a half ago. So we don't actually have any auditorium technicians who can run the equipment, but we're responsible for booking and reserving the space. So we're trying to work through some of those logistics on what events will look like going forward if we have furloughed staff into the future. I was asked a couple weeks ago to sit on the governor's subcommittee for arts and culture in the state of Michigan. And so there were about 30 of us who were asked to provide general feedback and guidance on how museums and libraries should reopen in the state of Michigan. We worked with a committee co-chaired by 2 museum professionals, one from the Henry Ford and the other from, I think it was the Kalamazoo Institute of Art, perhaps. In any event, or I'm sorry, Grand Rapids Public Museum was the other co-chair. In any event, we're still working through some of those guidelines. I don't think they've actually been released, despite the fact that museums technically opened yesterday, although I could be a bit behind on that information. But we're, like so many museums, trying to work through what those general guidelines look like. There have been some questions coming up about how are we determining capacity for both staff and visitors to come back. In the state of Michigan, it's been based off of the retail guidelines thus far. So we've been asked to think about visitors per 100 square feet in our space, based on both occupancy guidelines set by the fire marshal. That's one option. The other option is to calculate based on square footage. So we're still trying to work through our capacities and what that will look like for reopening. We typically have been open 7 days a week in pre-COVID-19. We're going to reopen at 3 to 4 days a week and part-time. So instead of being open 10 to 4, 10 to 5 each day, will be open 1 to 5 and probably Monday through Wednesday or Monday through Thursday at most. We're thinking about making Mondays a members Monday. So that way we don't have to deal with payment. It can just be membership cards, or they can show us those things on their phone and just walk on in. Cash handling has been something that we've debated quite a bit, both as a staff, but then also in our state subcommittee. We certainly don't want to deny access to the museum if cash is the only payment option, or if that is the preferred payment option for a visitor. And so we're thinking about, using payment boxes or something like that staff will collect and then deposit maybe once a week, instead of handling cash on a day-to-day basis and using a drawer. We just don't feel, I know our staff doesn't feel comfortable doing that. So I would say generally we've had a pretty good working relationship with the college as we think about plans for rolling out reopening. We've made it pretty clear where we feel uncomfortable with certain aspects of maybe the reopening operation, or where we just want a little more latitude. And the college has been, very respectful of our concerns and saying, yeah, if your staff is worried about that, or if they don't want to be in a situation where they feel unsafe, yeah, let's rethink that. So I think many of our colleges hopefully have been pretty accommodating in that regard. I'm going to stop there again in the interest of time, and I'm going to let Alex open this up for questions, and then our panels can kind of chime in, because I know the chat's been pretty active while I've been speaking.
It has been, yes, thank you. Some of the main questions, so I'm gonna let the panelists kind of answer the more direct questions in the chat themselves, but a few questions have had some themes to them, and I was wondering if one of our panelists could talk potentially about how you're either still planning on using, or not using students and volunteers in the front lines of your museum come this fall. And it may be that none of us have that answer quite yet, but if anybody is working on that or thinking about that, could anybody talk to that? Great, I'm seeing lots of heads. Okay, cool.
So we are waiting to hear if we can have students work in person. The
Okay.
fact that only 500 of the 1650 will be back, and most of them are first years, means they aren't students we've already trained.
Right.
Will be an issue. And we were told over the summer that just about all students had to work remotely, though I think there are a few who are allowed to work in dining, because we do have some international students who are here on campus and have nowhere else to go. So we have to provide some services. But otherwise, this campus is utterly shut down right now this summer. So if students are working for us, and we do have one student working for us, she is also working remotely. And we're hoping that won't be the case this fall, but we don't know.
Okay, great. Katie, would you mind commenting too?
Yeah, so I didn't really talk about our campus. I'll talk about that very briefly as well. So we're a land grant institution. We have about 18,000 students who are on this campus, many more than that who are at campuses, USU campuses around the state. We have 8 full-time staff here at the museum, and usually about 8 to 12 part-time staff, which those, most of those are students. We have, during the closure, been able to keep staff, the student staff who wanted to stay employed. Those who went home had the ability to do remote projects that many of us have, on the listserv have been discussing as well, especially early on in terms of database work and projects of that nature. We've had a few, I want to say there's been 3 students who have stayed and worked in the museum, and they have been spread out working on their own projects. And only recently have we allowed staff, there were some questions about deinstallation and installation, having staff wear masks where they can't maintain 6 feet of distance, and in order to deinstall or install works. And this, of course, are staff who are wanting to do that work. I have a mixture of staff working, coming into the office, and some who are not coming into the office. And I am, we've been encouraged and supportive of staff doing what they are comfortable with, and also are beginning to have discussions around a schedule for when we all do start to decide to come back, to ensure that there's, distance for those that work a bit closer. Our museum is free. That was a question. And I had posted this before in terms of the virtual programs and things that we all are looking to do now long-term and have become more of a priority, even though they were, for some, it was a priority. And for others like myself, we wanted it to be a priority, but it became a priority with the pandemic. And we partner with a local real estate company who uses Matterport, a virtual exhibition, a virtual tour platform software. And they're planning to continue to help us with creating virtual tours, which has been really great. And our K through 12 programs, we've adapted most everything we do to be offered either in person, a blended format, or a purely asynchronous online format, so that we can adapt regardless of what fall looks like for K through 12, because we know that it's going to vary and it may change. So that's something we're already, my K through 12 and outreach educators are already working on. Let's see. Oh, and then we have our reservation system. If you go to our website, where we're only scheduling visits out 2 weeks in advance right now for general visitors. But below it, if you are an educator who K through 12 or university class, it was really, we wanted to just go ahead and put that on there now, even though, classes aren't in session. But there's a separate form we use for them, because we want to ensure that they get priority if there is a way for us to accommodate those groups in any way in the fall, of which we don't really know what that will look like, that we already have forms in place that are separate for them to use. And we are located on the campus, and we're in a fairly remote area, as I mentioned before, in a valley. I think that was most of the question. I was jotting down things that people were asking.
There's been a lot coming at us. I'm wondering if I could pose another kind of overarching theme we've had is in terms of budget. Maybe Craig and Tricia, could you comment on how budget, whether cuts or non-updates or updates from your institutions, has impacted what you're doing right now and for the future?
Yeah, budget for us has been a tricky thing, of course, because we rely on a state appropriation. State appropriations have not been finalized yet, although we've been told that they will certainly be cut this year. We just don't know by how much. And so our college is planning for sort of a middle of the road cut in that projection. And so if we, hit that projection, then we should be fine. If we come in under that projection, then we may need to make additional adjustments budget-wise. We did quite a bit of budget restructuring for the museum anyway. I've been in this position about 8 months now, and so when I came on board, we did a little bit of restructuring, and so I'm hopeful that that will help absorb some of those budget cuts if they do come. Like many college museums, we also sort of spearheaded both an NEH Cares grant, which we submitted, and we've also submitted a handful of state grants as well. Membership revenue, that sort of thing, has held pretty much in line with what we typically bring in. So fundraising has been pretty active during this time, and we've extended memberships out beyond when we will reopen. The only budget move I've had to really make thus far has been furloughing our supplemental staff. And so they're like a third tier of employee. We have part-time, full-time, and then we have supplemental staff at the college. The supplementals typically work maybe 5 hours a week, sometimes 10. They're kind of an as-needed employee classification. So our auditorium, for example, is staffed by auditorium techs who are supplementals. They might work 5 hours 1 week, and then we might not have a program for 2 weeks, and so they're off duty at that point. most of those staff were furloughed because their work depended on being on campus, and all of our events were shut down. So we're not certain yet when they will be coming back. The same is true for our supplemental staff in the museum store and on our back ends, like our office assistants. Not sure when they'll come back.
Awesome. Thank you. Trisha, do you have some comments about budget?
Sure. So like Craig, we are dependent on the state appropriations. And so the end of this month, we'll know exactly what that is. But before that time, units were asked to prepare for a 14% budget reduction. We have just recently heard that it may not be 14%, it may be 11%. And I wondered if they told us 14% to make 11% seem not so bad. But so for the museum in particular, our state funds cover our general operations and the staff salaries. All of our programming, exhibitions, and all the associated programming we do with private funding. So when it comes to giving back state money, that means general operating funds and staff salaries. So unfilled positions are not going to be filled. There will be furloughs, most likely, we are all considered state employees, so there will likely be furloughs. So it is something that we really have to consider, particularly for us with general operating funds. If we need to buy a whole bunch of hand sanitizer and prepare our building to accept visitors, we need to make sure we have the funds available to do that. So it does seem like it could end up being a bit of a tricky situation. We are going to, I can't remember who it was, someone else said they were opening up with limited hours at first, and we are looking at doing the same thing, being open to visitors only a couple of days a week. So, so yeah, it's going to be an interesting process to see what those budget reductions, what kind of impact those budget reductions are going to have on the general operations in particular.
Thank you so much. Katie, did you have something to add?
Yeah, so in Utah, our situation here is, our budget, we receive about 45% of our overall budget comes from the state. And the state has been building a rainy day fund for some time. So they have asked everyone to look at 2, 5, and 10% budget cut scenarios and have those preliminary discussions while they assess things. July, once income tax revenue is collected, because that was extended, they'll have a better sense of where we are. And so the interesting thing is for all of us is that, it may be August, October, that some more specifics about our budget will be in place after we're already in the fiscal year. So for us, there was an exhibition that we were planning for the fall that we have postponed for next fall, and are actually curating an exhibition from our collection. I know many people will be looking who have collections to be utilizing their collections more. And we do a lot with our collection. Anyways, we have about 5,000 objects in our collection, but so not a huge collection, but focused on modern and contemporary American art with an emphasis on the West. But we're curating an exhibition titled The Day After Tomorrow, which is a response to the pandemic, and looking at how artists have dealt with other challenging moments in our history over the last 100 years. And that's opening actually in late June. So we very quickly shifted to work on that exhibition, which has been, I'm glad that we're doing that actually.
That's great. So it is 3:02, and Leslie had to leave to go work on a CARES grant, actually, which I thought was, yes, that was a good excuse. And I also know that there is an AAM webinar starting right now as well. So I think we should be cognizant of that. If the panelists, if you have a few minutes to stay on and maybe answer a few of these leftover questions to those individuals, that would be helpful. And I want to let everybody know, all the attendees, we are recording this. We do plan to have this on our website and YouTube channel. And then, of course, we'll be uploading documents, reopening, and sharing those on our website as well, as quickly as I can get them on there as possible. So thank you to our panelists, Craig, Trisha, Katie, and Leslie, even though she's no longer with us right now. I don't know if any of you have any parting words.
Yeah, I see in the chat that several folks are asking if we can have additional sessions like this. And I think that that's a great idea. We will certainly see if we can pull together a group and do a follow-up in 4 to 6 weeks. As far as some of the questions go today, feel free to contact any of us directly. We will be happy to answer any of your questions. And for questions where it looked like there was quite a bit of interest, or we can also post some of that to the listserv and try to get some answers there as well.
Great. Well, thank you all. We still have over 200 on here. A lot of I know you guys can all see the Q&A, I believe. I don't know if you want to pull those up, if anybody can answer those more specifically. Those were ones that I wasn't really able to answer as specific as I wanted to. Can I share the AAM webinar link? Let me see if I can find it really quickly. I think I actually have it.
There's a question about cleaning study drawers.
Yeah.
We do have a lot of study drawers, and we have those on a schedule that is for our attendants to clean. I need to double check you. I think it's every 2 hours, but it may be every hour. And the way being summer, I think the nice thing about for us to be able to reopen during the summer is it tends to be slower. We can work out some of the kinks. And our attendants, between our cameras around the galleries and our attendants, they can observe, a lot of times what is being, the few places where you can touch what is being touched, and monitor those to know, what needs to be cleaned. But I know that they have a schedule as well. So I'll share that in the documents that we post.
And we've had a few questions about having somebody on the panel or a future panel from a bigger city, which I do think would be helpful. I think one of the reasons we don't have that on this one today is because many of the people that we have been talking with in bigger cities, they're not as far along in their reopening strategies. And so we wanted to give some clout to the people who are reopening, today or next week or the week after. And then as we move through this, we can start to include those voices as well as much as possible.
Yeah, that's right. We did try to have a diverse kind of panel today in terms of the types of institutions, but you're right. The challenge is those of us that are in more rural locations maybe are a little ahead in terms of our reopening plans, just by the nature of the numbers of things.
Mm-hmm.
Right. I'm in Michigan, which has, of course, been a hot spot for COVID, but not necessarily Northwest Lower Michigan. So I'm a good 3.5, 4 hours from Detroit. So we're pretty far north, but not to say that, like in Utah, that there couldn't be a spike or we couldn't see an increase at some point here.
Right.
Yeah.
And Natalie does point out, we are planning on holding webinars every couple of weeks moving into the future. So please be on the lookout for those. We'll be posting them as we update them as much as possible, including, I think, probably another follow-up to this one in 4 to 6 weeks that would include some of those voices from larger institutions that may be in these points, hopefully at these points at that time. The AAM webinar, I did post the link in the chat. It is not live, that is correct. It is a reposting of one that they had last week that I had heard great things about.
I would say generally to Trisha's point, as we continue to develop our own plans and move forward, we're starting out with very much a sort of phased approach. Step one was to simply just get the staff back in for the next couple weeks, see how we do. Then we reopen on a very limited basis, 3 to 4 days a week, half hours that we typically have. And see how that goes. And then after another month and a half, we're going to reevaluate how that went. And then if we can add another day or add a weekend, we'll do that. But the college has asked us if we could consider, Friday, Saturday, Sunday for kind of both deep clean, but then also just, 72 hours where we can get people out of facilities and, see how things go. So, we're taking very much, again, a phased approach, hoping to continue to add and expand capacity as we go. But if we have to decrease the number of days that we're open or scale back again, we're ready to do that and transition back to more of the digital programming we've been doing.
And I think I mentioned we're doing reduced hours this summer, Wednesday, Thursday, Friday, noon to 6, and Saturday, 10 to 3. Initially to kind of see. I will also ask our event services folks about the reservation platform they use and see if it would be nice if we could find something for the field that is usable. As I mentioned before, the nice thing about it is that I can change it to requiring people to use it if that's something that we needed to do, or making it optional but changing our capacity. So if we wanted to reduce our capacity, it allows us to do that. So it allows some phasing flexibility, that I think is quite nice.
Oh, great. And we just had somebody in the chat saying that AAM has a list of resources for things like reservation platforms.
Yeah, probably.
That's helpful.
Yeah.
One last question, maybe. Have any of you experienced staff not feeling ready to come back? Are you requiring staff? Are you not requiring staff? Is that an institution level instead of the museum level? Have any of you started getting those kinds of questions?
Yeah. I haven't required staff. I think all of us are continuing to see the cases and kind of seeing how it's going to play out. I have some staff who have some health issues that are, where they're immune compromised and don't feel comfortable coming back. And I certainly wouldn't ask them to. And our university's been very supportive about, making sure we accommodate what people need. So we haven't had any issues in terms of being able to accommodate people, and I'm hoping that that continues.
Great. Trisha, you look like you might have something to add.
Yeah, we the director at GMOA is approaching it in the same way, so far at least, that as long as people can complete the majority of their work at home, they should stay at home. We have some people on staff with particular health issues that put them at higher risk. And the University of Georgia also, through their human resources system, there is a procedure for filling out a formal application for health accommodations. Mm-hmm. And so they are encouraging people to do that as well, so that if there is a time when there is a requirement to return, that those people have self-identified in a way and gotten approval to continue to telework.
Right.
Yep, same approach here. We haven't required anyone these last, over the next couple weeks to come back in. Some of our staff are at the point where working from home still makes more sense for them. That, if we're not yet open to the public, it doesn't really make sense for them to be here. They can still do that work at home. As we get closer to actually reopening to the public and we figure out how we're going to staff, especially our front desk and our store, given that we don't have the 80 or 100 volunteers that we had, or student support right now because it's summer, we're going to have to figure out what that looks like. But we're trying our best to take care of each other right now. And again, just recognize this is pretty exceptional time. So taking care of each other is the most important thing.
Yeah. Well, I think that's a great sentiment to end on about taking care of each other. As mentioned earlier, we are recording this, so we're gonna move to ending the recording, try to get that downloaded and uploaded to our website. And also we had a lot of questions about saving the chat, and Craig, I think you know how to do that.
Yeah, I think anyone can save it, actually. It's the 3 dots that pop out next to the chat box where you type, and then you can choose Save Chat. It'll download it, I think, as a text file. Although we can save it too and then post it somewhere if you're not able to do that.
Perfect. And I have it now on my computer, so it will be up on our website as quickly as possible.
Well, great. Thank you. Thank you, everyone, for attending today. Thank you to our panelists, and we will be in touch soon.
All right.